Hello, and welcome to your State of Connecticut Department of Developmental Services Alzheimer's and Dementia Training. Today's agenda, we will review dementia training compliance. We will review dementia, other conditions that have similar signs and symptoms of dementia, how dementia is diagnosed, a review of dementia statistics and how individuals with intellectual disabilities are affected, the stages of Alzheimer's disease, a review of Down syndrome, how to keep a safe and accessible environment, and the behavioral challenges and caregivers' response. Policy and training compliance. DDS training compliance is that in all residential settings that support individuals who are 50 years old or older with Down syndrome, agencies must have documentation that at least one staff per home, either in a CLA, CCH, CRS, ICF, etc., is annually trained on Alzheimer's and dementia care. This is because Policy Act number 14-194 is an act concerning the Alzheimer's disease and dementia task force, which is our recommendations on training. So what is dementia? Dementia is the loss of cognitive functioning, thinking, remembering, and reasoning to such an extent that it interferes with a person's daily life and activities. Some people with dementia cannot control their emotions and their personalities may change. Dementia does vary in severity. We are now going to watch a video on how a person with dementia sees the world.
On air as the sun rises tomorrow morning from 7 o'clock here on 107.9 FM.
Right. It's not raining. Good. What? I've forgotten. Should I?
Listen, just go sit down. Just go sit down.
Yeah. Right. Oh, that way. I don't know what. Oh, I don't know. Could you please? It's my list. Here I go. Because I don't know quite what. Oh dear. Chicken cheese.
What?
Chicken cheese?
Sorry.
Oh. I don't know. People with dementia have experiences like this every day. A little bit of understanding, tolerance, and patience can make all the difference.
I'll tell you what, if you go into the seats just there,
Right.
when we get there, I'll call you, okay?
Okay, madam.
I can't get on.
Let me help you. This way.
Thank you.
Can I have a look at that list?
Yes.
Chicken and cheese.
Oh,
Let's go this way.
thank you. find out how to become dementia friendly, contact Alzheimer's Society today.
We're now going to review the signs and symptoms of dementia. So experiencing memory loss, poor judgment and confusion, difficulty speaking, understanding and expressing thoughts or reading and writing, wandering and getting lost in a familiar neighborhood, trouble handling money responsibly and paying bills, repeating questions, using unusual words to refer to familiar objects, taking longer to complete normal daily tasks, losing interest in normal daily activities or events, hallucinating or experiencing delusions or paranoia, acting impulsively, not caring about other people's feelings, losing balance and problems with movement. The cause of dementia. So dementia is the result of changes in certain brain regions that cause neurons or nerve cells and their connections to stop working properly. Prevention of dementia is still unknown. However, leading a healthy lifestyle can reduce the risk factors. Currently, there is not a cure for dementia. Here is an image of a healthy brain versus an Alzheimer's brain. Types of dementia. So various neurodegenerative disorders and factors contribute to the development of dementia through a progressive and irreversible loss of neurons and brain functioning. There are forms of different types of dementia, which include Alzheimer's dementia, frontotemporal dementia, Lewy body dementia, vascular dementia, and mixed dementia. This umbrella here shows the percentage of people affected by each form of dementia. Other conditions. So other conditions might mimic the signs and symptoms of dementia. It's extremely important that a physician rules these out. Some examples of other conditions could be Huntington's disease, HIV-associated dementia, heavy alcohol use over a long period of time, a head injury, such as a concussion or from a fall or accident, emotional problems such as stress, anxiety, or depression. We also have other medical conditions such as tumors, vitamin deficiencies, medication side effects, or problems with our thyroid, kidney, or liver. Some of these causes of dementia symptoms can be halted or even reversed with treatment. So how is dementia diagnosed? So first, you are going to visit the primary care, and they're going to rule out any underlying conditions that we just talked about. Then they're going to do a review of the medical history, and that will include your family's history and yourselves. And then there's testing to be completed, cognitive and neurological tests, brain scans, psychiatric evaluations, genetic tests, some spinal fluid tests, and blood tests. Our statistics. So individuals with intellectual disabilities may be at an increased risk of developing dementia when compared to the general population. In people with intellectual disabilities, the prevalence of dementia is as high as 4% in individuals under 40 years of age and 40% in those in 60 years or older, with an average age of onset between 51 and 56 years of age. Research indicates that 95% of people with Down syndrome will develop Alzheimer's disease by the age of 65. So early stages of Alzheimer's. In the early stage of Alzheimer's disease, a person may function independently. They may still drive, work, and be part of social activities. They may feel as if he or she is having memory lapses, such as forgetting familiar words or the location of everyday objects. Symptoms may not be widely apparent at this stage, but family and close friends may take notice, and a doctor would be able to identify symptoms using certain diagnostic tools. Signs of the early stage of Alzheimer's disease is that the person is unable to produce the right words or name, unable to remember names when introduced to new people, having difficulty performing tasks in a social or work setting, forgetting material that was just read, losing or misplacing a valuable object, and experiencing increased trouble with planning and organizing. Our middle stage of Alzheimer's is typically the longest stage and can last for many years. As the disease progresses, the person with Alzheimer's will require greater level of care. During the middle stage of Alzheimer's, the dementia symptoms are more pronounced. The person may confuse words, get frustrated or angry, and act in unexpected ways, such as refusing to bathe. Damage to the nerve cells in the brain can also make it difficult for the person to express thoughts and perform routine tasks without assistance. Our signs of the middle stage are being forgetful of events or personal history, feeling moody or withdrawn, especially in socially or mentally challenging situations, being unable to recall information about themselves, like their address or telephone number, and the high school or college they attended. They may experience confusion about where they are or what day it is, requiring help choosing proper clothing for the season or an occasion, having trouble controlling their bladder or bowels, experiences changes in sleep patterns, such as sleeping during the day and becoming restless at night, showing an increased tendency to wander and become lost, or demonstrate personality and behavioral changes, including suspicious and delusional or compulsive repetitive behaviors like hand wringing or tissue shredding. The late stage of Alzheimer's. This is the final stage of the disease. Dementia symptoms are severe. Individuals lose the ability to respond to their environment, to carry a conversation, and to eventually be able to control movement. They may still say words or phrases, but communication about pain becomes difficult. The signs of our late stage will require around-the-clock assistance with daily personal care. They'll lose awareness of recent experiences as well as their surroundings. Experience changes in physical abilities, including walking, sitting, and eventually swallowing. They'll have difficulty communicating and become vulnerable to infections, especially pneumonia. Dementia and diversity. So people of color face discrimination when seeking health care for Alzheimer's disease and related dementia. The Alzheimer's Association shows that these populations reported higher rates of discrimination when seeking health care. 50% of Black Americans, 42% of Native Americans, 34% of Asian Americans, and 33% of Hispanic Americans. Non-Hispanic white Americans reported discrimination at a much lower rate of 9%. Understanding how different racial and ethnic groups view, access, and experience healthcare is critical to improving the healthcare system and helping healthcare providers care for an increasingly diverse population. Always be an advocate. We want to make sure we always create a safe and accessible environment for someone with a diagnosis of dementia or Alzheimer's disease. We want to make sure we simplify the home. Too much furniture can make it hard to move around freely. We want to get rid of clutter, such as piles of newspapers and magazines. Have a sturdy handrail on stairways. Put carpet on stairs or mark the edges of the step with brightly colored tape so the person can see them more easily. Remove small throw rugs. Use rugs with non-skid backing instead. Make sure cords or electrical outlets are out of the way or tacked to baseboards. Clean up spills right away. Shoes and slippers with good traction also help the person move around more safely. Make floors and walls different colors. This creates contrast and makes it easier for the person to see. Remove curtains and rugs with busy patterns that may confuse the person. Mark the edges of steps with brightly colored tape so people can see the steps as they go up or down the stairs. Use brightly colored signs or simple pictures to label the bathroom, bedroom, and kitchen. Be careful about small pets. The person with Alzheimer's may not see the pet and trip over it. We also want to limit the size and number of mirrors in the home and think about where to put them. Mirror images may confuse the person with Alzheimer's disease. Use dishes and placemats in contrasting colors for easier identification. Use signs with simple written instructions to remind them of danger or show them where to go. We want to label hot water faucets red and cold water faucets blue, or write the words hot and cold near them. Put signs near the oven, toaster, iron, or other things that may get hot. Pad any sharp corners on your furniture, or replace or remove furniture that has sharp corners. Always test the water to make sure it's comfortable temperature before the person gets in to bathe or shower. Don't play the TV, radio, or music too loudly, and don't play them at the same time. Limit the number of people that visit at any one time. If there's a gathering, settle the person with Alzheimer's in an area with fewer people. Shut the windows if it's very noisy outside. And if the person wears a hearing aid, check the batteries and settings often. Now take a look at this picture and think about what modifications we can make based on the information you just received. Behavioral and personality changes. So common personality and behavioral changes you may see with a person with dementia or Alzheimer's disease include getting upset or angry more easily, acting depressed or not interested in things, hiding things or believing other people are hiding things, imagining things that aren't there, wandering away from home, pacing a lot, showing unusual sexual behavior, hitting you or other people, misunderstanding what he or she sees or hears. You also may notice that the person stops caring about how he or she looks, stops bathing, and wants to wear the same clothes every day. Feelings such as sadness, fear, stress, confusion, or anxiety. Health-related problems may include illnesses, pain, new medication, or lack of sleep. Other physical issues like infections, constipation, hunger or thirst, or problems seeing or hearing may arise. Our caregiver's response. So we want to always keep things simple. Ask or say one thing at a time. Have a daily routine so the person knows when certain things will happen. Reassure the person that they are safe and that you're there to help them. Focus on the person's feelings rather than words. For example, you seem worried. Don't argue or try to reason with the person. Try not to show your frustrations or angers and take your space if needed. We are now going to watch a video on a caregiver's response to a family member that had dementia and Down syndrome.
My name is Daryl Riley. First and foremost, I am Carol Riley's brother and legal guardian. Carol, despite her Down syndrome, had a normal childhood. She enjoyed playing with her family, friends, and she was very much accepted as the person she was. She enjoyed her classmates very immensely and, in fact, kept in touch with them even after they were out of school. She then worked at Madison Opportunity Center. That was something very important to her life, was working. And of course, on payday, she let everybody know how much she got paid, and this was her money, and she really enjoyed it. She was very competitive, wanted to play baseball, join in games. She liked to go camping, fishing. So she had a very typical life. Then in early 2000, when Carol was approximately 50 years old, her caregiver started to mention that she noticed some little changes in Carol's life. Particularly, she was forgetful on things that were routine. She had her little chores around the house, such as setting the table and putting her laundry away, and pretty soon she needed reminders to do it. And then it got to a point where not only was she reminded to put her clothes away, but when Sherry went in to see how she was doing, she was still there with the clothes, trying to figure out what she should do with this. These were noticeable to Sherry. They weren't as noticeable to me because I saw Carol on occasion. I didn't see that type of behavior, but Sherry saw that Carol was not functioning at the level that she had been. But she always was very caring and jolly and happy and so forth, and all of a sudden she started to be upset. Things bothered her, and would never think of swearing or anything. And all of a sudden, she picked up a language that never had heard, so her personality changed completely. She was a different person, and this was very traumatic to the family as it was to Carol. And it was subtle things like instead of calling me by my name, she would say, "Hi, handsome." See, and that was her way of coping with the fact that she couldn't remember my name right away.
She used to be able to draw, write her name. She had all kinds of jokes to tell you. Then as the changes progressed and her dementia got going, she wasn't able to feed herself anymore, so we had to feed her, help her with her cares.
One of the things I've noticed over the years is that Alzheimer is a progression type disease. It seems like she's at a plateau and then it drops off and then she comes back to another plateaus and it continues for some time. At one time she could walk and she needed a walker and then finally a wheelchair type of thing. These are things that didn't happen overnight, they happen over a period of time. At the time, I thought I was too young and there was no need for it. Things like that, do it now. Now is the time. Pick someone younger than the person to be a guardian. There's a lot of resources out there. Contact people, talk to people, communicate with the doctor, talk to them, get feedback, and so forth. Make decisions earlier. You started seeing these progressions, but she had such a good life that it was hard to accept the fact that it had to change. This was something that I struggled with. Decisions like the DNR, do not resuscitate. This was a tough decision to make, but finally a decision was made, the papers were signed, and now in hindsight this was a good decision. The final thing I'd like to say is as you go through these decisions, is don't beat up on yourself. Make decisions. They may be right, they may be wrong, but make them and take every day as a separate day and enjoy the ups and then don't dwell on the downs.
So what is Down syndrome? Down syndrome is a condition in which a person has an extra chromosome. The chromosomes are small packages of genes in the body. They determine how a baby's body forms and the functions as it grows during pregnancy and after birth. Typically, a baby born with 46 chromosomes. Babies with Down syndrome have an extra copy of one of these chromosomes, which is chromosome 21. A medical term for having an extra copy of a chromosome is trisomy. Down syndrome is also referred to as trisomy 21. This extra copy changes how the baby's body and brain develops, which can cause both mental and physical challenges for the baby. People with Down syndrome usually have an IQ, which is a measurement of intelligence, in the mildly to moderately low range and are slower to speak than other children. The physical features of Down syndrome are a flattened face, especially the bridge of the nose, almond-shaped eyes that slant up, a short neck, small ears, a tongue that tends to stick out of the mouth, tiny white spots on the iris, which is the colored part of the eye, small hands and feet, a single line across the palm of the hand, small pinky fingers that sometimes curve towards the thumb, poor muscle tone or loose joints, and shorter in height as children and adults. So we have some different types of Down syndrome. First is trisomy 21, which is about 95% of the people with Down syndrome have trisomy 21. With this type of Down syndrome, each cell in the body has 3 separate copies of chromosome 21 instead of the usual 2 copies. We also have translocation Down syndrome. This type accounts for a small percentage of people with Down syndrome, about 3%. This occurs when the extra part of or a whole extra chromosome 21 is present, but is attached or translocated to a different chromosome rather than being a separate chromosome 21. Lastly, we have mosaic Down syndrome. This type affects about 2% of people with Down syndrome. Mosaic means a mixture or combination. Those with mosaic Down syndrome, some of their cells have 3 copies of chromosome 21, but other cells have the typical 2 copies of chromosome 21. The causes and risk factors. The extra chromosome 21 leads to physical features and developmental challenges that can occur among people with Down syndrome. Down syndrome is caused by an extra chromosome, but no one knows for sure why Down syndrome occurs or how many different factors play a role. One factor that increases the risk for having a baby with Down syndrome is the mother's age. Women who are 35 years or older when they become pregnant are more likely to have a pregnancy affected by Down syndrome than women who become pregnant at a younger age. Most babies with Down syndrome are born to mothers less than 35 years old because there are many more births among younger women. Health conditions related to Down syndrome. Many people with Down syndrome have common facial features and no other major birth defects. Some people with Down syndrome might have one or more major birth defects or other medical problems, such as hearing loss, obstructive sleep apnea, which is a condition where the person's breathing temporarily stops while asleep, ear infections, eye disease, and heart defects present at birth. Healthcare providers routinely monitor children with Down syndrome for these conditions. So how is Down syndrome diagnosed? There are 2 basic types of tests available to detect Down syndrome during pregnancy, which are screening tests and diagnostic tests. Screening tests are often include a combination of blood tests, which measure the number of various substances in the mother's blood, and an ultrasound, which creates the picture of the baby. During an ultrasound, one of the things that a technician looks for is fluid behind the baby's neck. Extra fluid in this region could indicate a genetic problem. These screening tests can help determine the baby's risk for Down syndrome. Rarely, screening tests can give an abnormal result even when there is nothing wrong with the baby. Sometimes the test results are normal and yet they miss the problem that does exist. Diagnostic tests are usually performed after a positive screening test to confirm Down syndrome diagnosis. The types of diagnostic tests include chronic visualist sampling, which examines material from the placenta, and amniocentesis, which examines the amniotic fluid, and then the umbilical cord sampling, which examines blood from the umbilical cord. These tests look for changes in the chromosome that would indicate Down syndrome diagnosis. So life with Down syndrome and the services that are available. Down syndrome is a lifelong condition. Services early in life will often help babies and children with Down syndrome to improve their physical and intellectual abilities. Most of these services focus on helping children with Down syndrome to develop to their full potential. These services include speech, occupational, and physical therapy. The statistics. So Down syndrome remains the most common chromosomal condition diagnosed in the United States. Each year, about 6,000 babies born in the United States have Down syndrome. This means that Down syndrome occurs in about 1 in every 700 babies. According to the National Down Syndrome Society, about 30% of people with Down syndrome who are in their 50s have Alzheimer's disease. About 50% of people with Down syndrome in their 60s have Alzheimer's disease. The content that you have seen today is property of the Connecticut Department of Developmental Services. This includes our graphics, logos, icons, images, and audio and video files, and is protected by applicable state and federal laws. Any material contributed by a third party is used but with the author's permission, remains the property of the respected author, and it's also protected by applicable law. You may download, view, copy, reproduce, or distribute and print the material on this site for training purposes only, provided that you do not distribute the material for sale or profit. We always appreciate your feedback on training. If you would like to take a moment to scan this QR code and tell us what you thought of today's training. Thank you, and if you have any questions, please contact dds.training@ct.gov.